It's a quiet Tuesday morning in November. Margaret, 72 years old, walks to her mailbox like she does every day. She pulls out a thick white envelope from her insurance company. The return address says, "Important action required." Her hands start to shake. She sits down at the kitchen table, opens the letter, and reads 4 words that make her stomach drop. Your plan is terminating. Her Medicare Advantage plan, the one that has covered her diabetes, her heart medication, her doctor visits for the last 7 years, is ending on December 31st. She picks up the phone, calls an insurance agent, and says, "I want Plan N. I've heard it's affordable. Sign me up." The agent goes quiet, then says, "Ma'am, I'm sorry, you don't qualify." Margaret had no idea, and right now, 2.6 million seniors across America are about to walk into the exact same trap. Hello, my friend. I am Georgia, a senior policy analyst, and for over a decade, I have helped retirees just like you understand the rules that the insurance companies hope you never read. Today, I need you to listen carefully, because what I am about to share is not a rumor. It is written in federal law confirmed by Medicare.gov, AARP, and the Kaiser Family Foundation. If your Medicare Advantage plan is being terminated for 2026, or even if it is just changing, there is a hidden rule about Medigap Plan and that could leave you with no supplemental coverage at all, and one wrong move could cost you tens of thousands of dollars in medical bills. I am going to walk you through the exact rule, the exact deadline, and the exact 3 steps to protect yourself. But please, stay with me until the end of this video. Because there is one tiny mistake almost every senior makes in the final 63 days. And if you make it, you could lose your coverage for life. I will reveal it near the end. Let me tell you about Robert. Robert is 71 years old. He retired from a quiet career as a high school history teacher in Ohio. He worked hard, paid his taxes, and chose a Medicare Advantage plan back in 2019 because it had a $0 premium and gave him a small allowance for over-the-counter vitamins. For 6 years, Robert did everything right. He paid his Part B premium on time. He never missed a doctor appointment. He even kept a folder labeled Medicare in his filing cabinet. Then, in October 2025, Robert received a letter, what Medicare calls an ANOC, the Annual Notice of Change. His insurance company told him his plan was being discontinued in his county one for 2026. Robert was not panicked. He was a careful man. He called an agent and said, "I'd like to switch to Original Medicare and add Plan N. I hear it has lower premiums." The agent took down his information and then asked the questions Robert never expected. "Robert, have you ever been treated for congestive heart failure? Are you currently taking Lasix? Have you been hospitalized in the past 2 years?" Robert answered honestly, "Yes, yes, and yes." 3 days later, he got a denial letter. Plan N would not accept him. Robert thought he was protected. He thought because his plan was being terminated, the law guaranteed him any Medigap plan he wanted. He was wrong. By the time Robert understood the rule, the 63-day window had almost expired. He scrambled to get Plan G, which was guaranteed, but his premium was nearly twice what Plan N would have cost. That one mistake will cost Robert thousands of extra dollars every year for the rest of his life. And here is the painful truth. Robert's story is not rare. It is happening to seniors in all 50 states right now. Let me show you exactly what the law says, so this never happens to you. Now let me explain the law in plain English. Take a breath. We are going slowly. The core rule, federal law, specifically the Omnibus Budget Reconciliation Act of 1990, says that you only have one time in your entire life when an insurance company must sell you any Medigap policy you want with no health questions asked. That window is 6 months long. It begins the very first month you turn 65 and are enrolled in Medicare Part B. After those 6 months are up, that protection disappears forever unless something special happens. What special means? If your Medicare Advantage plan is terminated, discontinued, or stops serving your area, federal law gives you a second chance. It is called a guaranteed issue right. But here is the catch, and please write this down. The federal guaranteed issue list only includes plans A, B, C, D, F, G, K, and L. Plan N is not on the list. Plan M is also not on the list. This means if your Medicare Advantage plan ends and you want Plan N, the insurance company has the illegal right to ask you health questions and to deny you based on your medical history. The conditions that get seniors denied. According to a Kaiser Family Foundation review of 15 major insurance applications, here are the conditions that can get you automatically denied. For Plan N, Alzheimer's disease, asthma that requires inhalers, cancer, congestive heart failure, diabetes with complications like neuropathy, end-stage renal disease, high blood pressure, stroke or COPD, or taking certain medications like insulin over 50 units per day, Lasix, Revlimid, or Remicade. If even one of these applies to you, an insurance company can legally turn you down for Plan N. The 63-day deadline. Now listen very carefully. The application window is strict. You have 60 days before your Medicare Advantage coverage ends and are no more than 63 days after it ends to apply for a Medigap policy under your guaranteed issue right. Miss that window, and your federal protection is gone. And here is the misconception that traps thousands of seniors. Many people think the deadline is December 7th, the end of open enrollment. It is not. The clock starts ticking from the date your plan actually ends, usually December 31st. The trial right myth. Many seniors have heard about something called a Medicare Advantage trial right. They assume it protects them. It does not. The trial right only applies to people in their first 12 months of being on Medicare Advantage for the very first time in their life. If you have been on Advantage for 2, 3, or 7 years like Robert, the trial right does not protect you. The state lottery. Here is something almost no one tells you. Only 4 states in the entire country require insurance companies to sell you a Medigap policy without health questions year-round, regardless of your health. Connecticut, Massachusetts, Maine, and New York. Minnesota is adding limited protections starting August 1st, 2026, but only for people aged 65 to 70. If you live in any of the other 45 states, you have very limited protection. According to KFF, that means 22.4 million seniors. About 9 out of every 10 Medicare Advantage members aged 65 and over face full medical underwriting if they want to switch. Now, this is where it gets dangerous. Let me show you what happens if you ignore this rule. The consequences. 1. If you miss the 63 days, you fall back to original Medicare with no supplemental coverage. And here is the scary part. Original Medicare has no annual out-of-pocket cap. None. A single hospitalization or cancer diagnosis could leave you owing tens of thousands of dollars in 20% coinsurance. 2. You may be forced into another Medicare Advantage plan in 2026, and AARP has confirmed many of these plans are stripping benefits. For next year, many are eliminating the over-the-counter allowance, dental, vision, and gym memberships. The plan you end up in may be far worse than the one you lost. 3. If you drop Medicare Advantage, but forget to enroll in a separate Part D drug plan, you trigger the Part D late enrollment penalty, a permanent 1% per month surcharge on your drug premiums for the rest of your life. This is why I am telling you. Please do not wait. Let me give you your action plan now. Here are the 3 exact steps every senior must take right now if your Medicare Advantage plan is changing or ending in 2026. Step 1. Find and save your plan termination notice. If your insurance company is ending your plan, they are federally required to send you a written notice. This is your legal proof of guaranteed issue rights. Keep every letter, every email, every claim denial. Put them in one folder. You will need to attach copies to your Medigap application to prove you qualify. If you cannot find your notice, call your plan and request a written copy today. Step 2. Call SHIP for free, unbiased counseling. Before you buy anything, do not call a random insurance agent first. Insurance agents earn commissions and may push you toward the wrong plan. Instead, call the Hot State Health Insurance Assistance Program, also called All SHIP Now. It is the official government-endorsed counseling service. It is all free, it is all unbiased. They do not sell anything. You can reach them by calling ALK 1-800-MEDICARE and asking to be connected to your local SHIP counselor. They will tell you exactly which Medigap plan you are guaranteed in your state and which one you are not. Step 3. Apply within the 63-day window and apply for a guaranteed plan. First, if you have any pre-existing condition, diabetes, heart issues, cancer history, high blood pressure, do not start with Plan N. Start with one of the federally guaranteed plans. A, B, C, D, F, G, K, or L. Plan G is the most popular replacement and is guaranteed under federal law when your Advantage plan terminates. Once you are safely enrolled, then, and only then, can you explore switching to Plan N later, especially if you live in a state with a birthday rule, like California, Oregon, Illinois, or Nevada. And remember the hidden mistake I warned you about? Here it is. Do not cancel your Advantage plan before Medigap is approved. Many seniors cancel their Medicare Advantage plan first, thinking they are being responsible. Then they apply for Medigap and get denied or delayed. By then, they are stuck with no supplemental coverage and no way to go back. The correct order is: apply for Medigap first, get approved in writing, then let your Advantage plan end naturally. Medigap cannot start until Advantage ends, but you must already be approved before that day arrives. Also, if you drop Advantage, enroll in a standalone Part D drug plan within the same window, or you will pay the lifetime late enrollment penalty. My friend, please hear me on this. The rules around Medicare and Medigap are changing faster than ever. 2.6 million seniors are losing their plans this year. ANOC letters are being mailed to homes across America right now, and the insurance companies are not going to call you and warn you about Plan N. That is why I am asking you to do one important thing. YouTube notifications are unreliable. The platform decides what you see, not you. So if you wait for the next video to pop up in your feed, you may miss the alert that saves your benefits. Click the link in the description below and join the Boppert's Global Senior Alerts official WhatsApp channel. When you join, you will get a one free download of the Senior Benefits Protection Guide, a printable PDF with every Medicare deadline, every guaranteed issue plan, every state rule, and the SHIP contact for your area. Real-time alerts about Social Security changes, pension rules, banking restrictions, insurance updates, and travel regulations affecting seniors. And direct notice the moment a new rule like this one is announced. before it hits the mainstream news. You worked your whole life for these benefits. You earned every dollar. Do not let one piece of paperwork, one missed deadline, take it from you. Share this video with one friend, one neighbor, one sister or brother who is on Medicare Advantage. You may save them thousands of dollars. I am Georgia. Stay informed, stay protected, and I will see you in the next video.